The U.S. Department of Health and Human Services Office for Civil Rights is the go-to resource for all things HIPAA. The Office for Civil Rights works to ensure equal access to specific health and human services, while also protecting the privacy and security of individually identifiable health information. That is where HIPAA comes in. HIPAA, the Health Insurance Portability and Accountability Act, is the primary law that protects health information. HIPAA governs how protected health information, known as ePHI, can be used and shared. In our age of cybersecurity, ePHI is at times referred to as ePHI, or Electronic Protected Health Information. Under HIPAA, protected health information includes verbal or recorded information that's created or received by a specific entity that relates to an individual's physical or mental health, or condition healthcare, or a payment for healthcare. This information can relate to an individual's past, present, or future situation, and is typically transmitted or maintained electronically, although transmission and storage can be non-electronic and still be covered under HIPAA. Many things qualify as ePHI. In fact, there's 18 categories of ePHI. Some examples include social security numbers, biometrics like fingerprints or voice prints, full face photos, health plan account numbers, and many others. This training will explore the main rules of HIPAA, methods of safeguarding ePHI, an overview of the rights and protections provided by HIPAA, common violations to avoid, and the potential consequences for being found HIPAA non-compliant. You may be confused as to whether HIPAA even applies to you. HIPAA covers information created, received, or maintained by healthcare providers or health insurance plans. Although closely linked to healthcare, HIPAA can apply directly to human resource employees, safety personnel, workplace wellness program employees, anyone involved in the exchange of personally identifiable health information. Strictly speaking, only covered entities and their associates are required to comply with HIPAA regulations. A covered entity is, again, someone who works in healthcare, with health plans or related clearinghouses. But it also covers those who are contracted out by these groups, known as business associates. If you have any official business with a healthcare provider or health insurer that involves the use, transmission, or storage of personally identifiable health information, you're a covered entity, or at least a business associate, meaning you must follow HIPAA's expectations. There's 4 major rules we'll explore: the privacy rule, security rule, enforcement rule, and the breach notification rule. Each of these covers guidance on building a culture and infrastructure of compliance and health information security. The privacy rule sets the parameters for how personally identifiable healthcare information can be used and disclosed without already having patient consent or authorization. This is the heart of the privacy rule, since patients, healthcare subscribers, and research subjects can of course give permission for their information to be used by means of a privacy rule authorization or through an informed consent document. When research is involved, documentation is vetted through an institutional review board via a typically rigorous and thorough process. In short, the privacy rule protects individuals by limiting what an agency or other group can do with information that could be potentially linked back to them. The related authorizations are in place to allow work to be completed while still safeguarding privacy. The security rule sets the standards for what safeguards must be in place to ensure the confidentiality, integrity, security, and availability of electronic protected health information. This includes administrative, physical, and technical security means. Within reason, given the size, complexity, and capabilities of an organization, a covered entity or business associate must ensure that workers comply with these provisions as well, and that they take reasonable and appropriate steps to protect against threats or hazards to information security or integrity. Both the privacy rule and the security rule stipulate the need for security awareness and training for employees of covered entities. This training must be completed within a reasonable time frame of initial employment, and all HIPAA-related records must be kept for 6 years. The enforcement rule was put into place to put some power behind the existing requirements. This rule emphasizes the criminal and civil consequences of violations, including increased financial penalties. In effect, this is the part of HIPAA that acts as a deterrent to non-compliance. The breach notification rule outlines under what conditions individuals must be notified in the event of information breaches. Cyber crimes like hacking, as well as other thefts or even just lapses in security, can constitute a breach. Theft or improper use or access of digital technologies such as pagers, laptops, cell phones, social media, tablets, and other devices or services can lead to ePHI insecurity. Taken together, an omnibus final rule was provided which further established and strengthened these four rules. It was the omnibus rule that expanded HIPAA to include the business associates of covered entities. There's other implications within HIPAA's language. Understanding and application of these four rules will assist your organization in building that culture of compliance and data security. Let's now take a closer look at some of the practical safeguards you can put in place to address strengthening that culture and building the infrastructure needed for compliance. There are three main categories for safeguarding protected health information. These are administrative, physical, and technical. Administrative safeguards relate to implementing updated policies and procedures aimed at prevention, detection, containment, and correction of security violations. This is both at an organizational level and also covers responsibility of individuals. Workers who are involved with any of the HIPAA categories of information may need to sign a HIPAA employee confidentiality agreement as part of an administrative safeguard policy. Further examples include limiting access to records, implementing accessible use policies, developing disciplinary procedures for HIPAA violations, development and testing of emergency and breach response plans, and of course, ongoing supervision, assessments of policy effectiveness, and security training. Information that's no longer necessary should be destroyed based on reasonable policies. Physical safeguards include the protection of electronic records, systems, and equipment. These include limiting access through locks or separation of workspaces. Security and space monitoring systems are an integral part of physical safeguarding. It's necessary to know who has access to information. This is especially important to know in the event of a data breach. Technical safeguards include measures such as data encryption and access authorization. This covers cybersecurity protocols surrounding system software and equipment, including memory backups, access logs, and activity monitoring. Each of these three categories must be integrated through policies, procedures, and practices in order to safeguard the rights and information of individuals. Healthcare patients, insured individuals, and research subjects, along with anyone else whose HIPAA-covered ePHI is involved, have the right to examine and receive copies of their records. This is known as availability of personal information under HIPAA. They also have the right to these records corrected if errors exist. There is often a processing fee for obtaining these records, and the information may not be immediately available. But these records must still be reasonably attainable. When information consent or a privacy rule authorization is on file, protected health information may be used or disclosed, but only within the parameters of the patient's authorization. Individuals also have the right to know when and why their health information has been shared for certain purposes. Keep in mind that one of the major goals of HIPAA is to prevent identity theft. Limiting the amount and type of information collected and transmitted to minimal levels supports this objective. In some cases, individuals authorize others to hear or otherwise receive their health information. For example, during a doctor's visit when they bring someone else with them. Information will also need to be relayed in order to carry out treatment, payment, and other related activities. For covered entities, written acknowledgement of receipt by an individual of your organization's Notice of Privacy Practices documentation should be obtained whenever possible. This notice should outline the individual's rights and protections. Employers are still permitted to ask employees for a doctor's note for use of sick leave or absence from work, vaccination information, and other data important to carrying out business. In the process of conducting business, however, covered entities and business associates must work to avoid non-compliance violations. Individuals who feel their rights under HIPAA have been violated may file a complaint with the Office for Civil Rights. HIPAA violations can range from what might be considered honest mistakes all the way through severe and willful noncompliance. There are 4 distinct penalty levels. In Tier 1, the violator had no reasonable way to predict or prevent the breach. A Tier 2 penalty is one which could have been prevented or at least recognized early on through due diligence. Willful neglect followed by corrective action qualifies as a Tier 3 violation, whereas willful neglect without a reasonable and timely effort to correct the noncompliance falls into the 4th and highest tier. If the proper policies are in place, poor practices will result in disciplinary action, such as written warnings or even termination of employment, before they lead to damaging security breaches. Depending on the number and severity of violations, along with considerations for whether or not reasonable precautions were taken, monetary penalties can range from hundreds to tens of thousands to well over $1 million. Violations might even result in several years of imprisonment. Common HIPAA violation examples include sharing ePHI without proper authorization, not providing patients with a notification of rights, breaches and failing to report breaches of protected health information, sending ePHI through insecure means, such as social media or email, and even disposing of ePHI records using poor methods. These do not represent a complete list of potential violations. Clearly, it's better to build a culture of compliance and data security than one that requires hurried remediation due to negligent and poor safeguarding practices. The National Institute of Standards and Technology provides a HIPAA Security Toolkit application that helps organizations understand, assess, and implement the requirements of the security rule within their operational environment. In addition, the Office of the National Coordinator for Health Information Technology and the Health Human Services Office for Civil Rights have jointly developed a security risk assessment tool for use by medium and small organizations. The Centers for Medicare and Medicaid Services provide an online covered identity decision tool to help determine your organization's compliance requirements under HIPAA. Other laws exist to ensure the privacy and security of information, such as the U.S. Privacy Act of 1974 and the Americans with Disabilities Act. The scope of this training was limited to HIPAA. Be sure to seek out information on other federal and state laws related to your workplace. Consider providing your team with training on cybersecurity, as this will further prepare IT and other personnel to employ safeguards and anticipate potential attacks by cyber criminals. If you are a covered entity or business associate, provide regular and varied training at all levels to make your employees aware of the safeguards required and consequences of information breaches. Be sure to document training and make use of the available tools and information. Also, make sure to include your employees in the development and testing of your emergency and breach response plans. Depending on the nature of your organization, you may need a designated HIPAA security and a HIPAA privacy officer. These measures are all part of building a culture and infrastructure of compliance and health information security. Whether uncovered through tips or complaints, external audits, or investigations into a known data breach, violations of HIPAA regulations are best avoided altogether. With the proper administrative, physical, and technical safeguards in place, covered entities and their business associates give themselves the best chance at avoiding HIPAA violations. Even if non-compliance is not an issue, following HIPAA guidelines will aid any organization in further ensuring information privacy and security.